Hello everyone, and welcome to today's presentation. I'm excited to have you here. Today, we'll be discussing the epidemiology of ARI and pneumonia. The slide you see now is our cover slide, titled Epidemiology of ARI and Pneumonia. Over the course of this session, we'll explore important data and insights about the prevalence, impact, and distribution of these respiratory illnesses. So let's dive in and get started. Infection of the respiratory tract is known as ARI, or acute respiratory infection. ARI can affect any part of the respiratory system, from the nose all the way down to the alveoli in the lungs. Depending on where the infection occurs, the symptoms can vary quite a bit. For example, an infection in the nose might cause a runny nose and sneezing, while one in the alveoli might lead to more severe symptoms like difficulty breathing. We often classify ARI based on the clinical syndromes it causes, which essentially means grouping these infections according to the site of infection and the symptoms they produce. It's important to recognize that ARI is a leading cause of death among children under 5 years old, especially in developing countries where healthcare access and sanitation might be limited. And interestingly, Southeast Asia has the highest incidence of ARI cases. This highlights how significant this issue is in that region. Understanding the patterns and impact of ARI is crucial as we work towards better prevention and treatment strategies across different populations. In India, pneumonia remains a significant cause of child mortality, accounting for about 13 to 16% of all deaths in pediatric hospitals. That's a considerable proportion, highlighting how serious this issue is in our healthcare landscape. Statistics also show that, on average, each child experiences around 5 episodes of acute respiratory infections, or ARI, every year. That's quite frequent, and it emphasizes how common these infections are among children. Furthermore, ARIs are responsible for roughly 3.5% of the global disease burden caused by respiratory illnesses. This global perspective shows that ARIs are not just an Indian problem, they're a worldwide health challenge. Lastly, it's important to note that about 20% of deaths in children under 5 are attributed to respiratory tract infections. This underscores the critical need for effective prevention and treatment strategies to reduce these preventable tragedies. All these points remind us why addressing pneumonia and ARIs is so vital in improving child health outcomes, both in India and globally. This slide doesn't contain enough information. That's why we're moving to the next slide. Today, I want to talk about ARI, which you might also see referred to as AURI or ALRI. These stand for acute upper respiratory infection and acute lower respiratory infection, respectively. It's important to understand that these classifications help us identify where in the respiratory tract the infection is located. When we talk about upper respiratory infections, we're referring to common illnesses like the common cold, pharyngitis, and otitis media. These are usually less severe and affect areas like the nose, throat, and ears. On the other hand, lower respiratory tract infections involve more serious conditions such as epiglottitis, laryngitis, laryngotracheitis, bronchitis, bronchiolitis, and pneumonia. These impact the deeper parts of the respiratory system, like the airways and lungs, and often require more intensive management. Classifying ARI into upper and lower categories is crucial because it guides our approach to treatment and helps us understand the severity and potential complications. This classification ties into the overall theme of respiratory health. Knowing where the infection is helps us act accordingly to protect our patients and reduce the risk of serious outcomes. This slide doesn't contain enough information. That's why we're moving to the next slide. Let's take a closer look at the epidemiological factors that influence disease patterns. These factors are crucial because they help us understand how and why diseases spread within populations. When we talk about epidemiology, we're essentially examining the distribution and determinants of health-related events. One key point is that epidemiological factors include things like age, gender, genetics, and lifestyle choices, which can all affect disease risk. For example, certain age groups might be more vulnerable to specific illnesses, or lifestyle habits like smoking and diet can significantly influence health outcomes. Environmental factors also play a major role. This includes exposure to pollutants, sanitation levels, and access to healthcare, all of which can either increase or decrease disease prevalence in different communities. Understanding these factors allows us to identify at-risk populations and develop targeted prevention strategies. This is especially important in our overall goal of controlling and reducing disease impact. So, by analyzing epidemiological factors, we gain valuable insights that help shape effective public health policies and interventions, ultimately working toward healthier communities. The microbial agents that cause acute respiratory infections are actually quite numerous. When we talk about these agents, they can generally be classified into three main categories: bacteria, viruses, and other agents. Understanding these classifications is important because it helps us grasp the diversity of pathogens involved and the different ways they can affect our respiratory system. Bacteria are single-celled organisms that can sometimes be treated effectively with antibiotics, but many viral infections require different approaches. Viruses, on the other hand, are smaller and often more challenging to target with medications. And then there are other agents, which can include fungi or even parasites, although these are less common in ARIs. Recognizing the variety of microbial agents emphasizes the complexity of ARIs and the importance of accurate diagnosis and appropriate treatment strategies. This classification also ties into the overall theme of understanding pathogen diversity to better prevent and manage these infections. Now let's take a closer look at some of the key bacterial pathogens we've been discussing. On this slide, we have a table listing several important bacteria. First, we see Bordetella pertussis, which is the causative agent of whooping cough, a highly contagious respiratory disease. Next to it, we have Corynebacterium diphtheriae, responsible for diphtheria, another serious respiratory illness. Moving along, Haemophilus influenzae is notable for causing meningitis and other invasive infections, especially in children. Then we have Klebsiella pneumoniae, a bacteria often associated with pneumonia, particularly in hospitalized or immunocompromised patients. Following that, Legionella pneumophila is known for causing Legionnaire's disease, a severe form of pneumonia linked to contaminated water sources. We also see Staphylococcus pyogenes, which can lead to a variety of infections, from sore throats to more severe invasive diseases like necrotizing fasciitis. Lastly, we have Streptococcus pneumoniae and Streptococcus pyogenes, both of which are major culprits in respiratory infections, pneumococcal pneumonia and strep throat, respectively. Recognizing these bacteria and their roles helps us understand the broader picture of bacterial infections and their clinical impacts. They're central to our discussion about infectious diseases and the importance of proper diagnosis and treatment. Now let's take a closer look at the table here, which highlights some of the major viruses that we encounter. On the left, we have adenovirus and enteroviruses, both of which are quite common and can cause a range of illnesses. Moving to the right, we see influenza viruses, specifically types A, B, and C, which are responsible for the flu season. Underneath that, we have measles, which is a highly contagious disease. Also included are parainfluenza viruses, which often cause respiratory infections, especially in children, and respiratory syncytial virus, or RSV, a major cause of bronchiolitis and pneumonia in infants. On the bottom right, we see rhinovirus, which is a common culprit behind the common cold, and coronavirus, which we've all become very familiar with recently due to the pandemic. The key takeaway here is that these viruses are diverse, but they all share the ability to cause respiratory diseases and other illnesses, emphasizing the importance of understanding their characteristics for prevention and control. This table really underscores how varied viral pathogens can be, yet many of them target similar systems, which is a crucial point in our overall discussion on infectious diseases. Now, let's take a closer look at some of the key infectious agents involved in respiratory diseases. First up, we have Mycoplasma pneumoniae. This tiny bacterium is known for causing atypical pneumonia, often referred to as walking pneumonia, because it tends to produce milder symptoms that might not always require hospitalization. It's quite common, especially in young adults, and spreads easily through respiratory droplets. Next, we have Coxiella burnetii, the agent responsible for Q fever. It's a bit different because it can be transmitted from animals to humans, often through inhalation of contaminated aerosols from livestock. Q fever can cause flu-like symptoms and sometimes more severe complications, making it an important zoonotic concern. Then there's Chlamydia type B, which is another important pathogen. It can cause respiratory infections, especially in children, and is known for its ability to cause persistent infections that may be difficult to diagnose and treat. Finally, there are other agents, which include various bacteria, viruses, and even fungi that can contribute to respiratory illnesses. Overall, understanding these infectious agents helps us better grasp the complexity of respiratory diseases and emphasizes the importance of accurate diagnosis and targeted treatment strategies. This knowledge ties into our broader theme of managing infectious diseases effectively. Let's take a closer look at host factors. These are the characteristics related to the individual or the environment that can influence health outcomes. Key points include age, gender, genetics, and lifestyle choices, all of which can impact how someone is affected by health issues. For example, age can influence immune response, while genetics may determine susceptibility to certain diseases. Lifestyle factors such as diet, physical activity, and habits like smoking or alcohol use also play a crucial role. Recognizing these host factors helps us understand why some people are more vulnerable than others, and allows us to tailor prevention and treatment strategies accordingly. Connecting this to our overall theme, considering host factors is essential for a comprehensive approach to health, as they interact with environmental and pathogen factors to shape overall health outcomes. Small children are especially vulnerable to this disease, and unfortunately, they can succumb within just a few days of falling ill. This rapid progression highlights how aggressive the disease can be in our most fragile populations. We also see that case fatality rates tend to be higher among young infants and children who are malnourished, which underscores the importance of early detection and nutritional support. It's crucial to recognize that while children are highly affected, adults are not immune. Interestingly, symptoms in adults can also be quite significant, and in fact, they tend to be more pronounced among females. This variation in severity and presentation across different age groups and genders is a key part of understanding how the disease impacts diverse populations. As we consider the overall picture, these points remind us that targeted prevention and treatment strategies are essential to reduce mortality rates across all age groups. Environmental factors play a crucial role in shaping the success and sustainability of any business or project. When we talk about these factors, we're referring to the external elements that influence our operations but are beyond our immediate control. These include things like economic conditions, social trends, technological changes, environmental regulations, and even cultural norms. Understanding these factors helps us anticipate potential challenges and identify opportunities. For example, a shift toward greener policies might require us to adapt our processes or innovate new sustainable products. Or, changes in social attitudes could affect consumer preferences, guiding us to adjust our marketing strategies. By keeping a close eye on the environment around us, we can make more informed decisions. It's about aligning our goals with external realities to ensure long-term success. This awareness also connects to the broader theme of strategic planning, being proactive rather than reactive. So, recognizing and analyzing environmental factors isn't just an exercise in awareness. It's a vital part of our overall strategy for growth and resilience. Let's take a closer look at how climatic conditions and housing quality can influence respiratory health. Overcrowding is a significant factor here, as it facilitates the spread of infections among children. Poor nutrition and low birth weight also play crucial roles, weakening the immune system and making children more vulnerable. Additionally, intense indoor smoke pollution, often from cooking methods or heating sources, underlines the high rates of respiratory issues we see. Socioeconomic status is another critical element. Children from low-income families tend to face more exposure to these risk factors. For example, infections are particularly common among preschool children attending day care centers, where close contact accelerates transmission. We also observe that infections tend to be more prevalent in urban communities compared to rural areas, likely due to higher population density and pollution levels. Lastly, maternal smoking has been linked to an increased occurrence of respiratory tract infections during a child's first year. This highlights how maternal behaviors can directly impact a child's respiratory health early on. All these factors demonstrate how environment, socioeconomic status, and lifestyle choices intertwine to influence respiratory health, emphasizing the importance of addressing these broader determinants in our overall approach. Let's take a closer look at the epidemiological triad, which is fundamental to understanding disease transmission. First, we have the agent, which can be bacterial, viral, or other types of pathogens. These are the cause of the disease itself. Next, the environment plays a crucial role. Factors like climate, poor housing conditions, overcrowding, and low birth weight can all influence the spread and severity of diseases. These environmental factors often create the perfect setting for transmission to occur. Finally, we have the host, which in many cases includes children or individuals suffering from malnutrition. These vulnerable populations are more susceptible to infections because their immune systems are weakened. Understanding how these three components, agent, environment, and host, interact helps us develop more effective strategies for prevention and control. By addressing not just the pathogen, but also improving environmental conditions and protecting vulnerable hosts, we can have a much greater impact on reducing disease burden. The organisms are transmitted by the airborne route. This means that infectious agents can be spread through tiny particles in the air, such as droplets or aerosols, when an infected person coughs, sneezes, or even talks. It's important to understand that these airborne particles can remain suspended in the air for some time and travel distances, increasing the risk of transmission. The chain of infection is maintained by direct person-to-person contact. So once these organisms are airborne, they can be directly transferred from one person to another, especially when people are in close proximity. This highlights the importance of personal contact in the spread of many infections, and why measures like hand hygiene and avoiding close contact are crucial in controlling transmission. Now, this slide specifically focuses on the mode of transmission. Recognizing that airborne transmission and direct contact are primary pathways helps us understand how infections spread and what precautions are most effective. Ultimately, controlling these modes of transmission is key to preventing outbreaks and protecting public health. Let's go through some of the common clinical features we see with acute respiratory infections. Patients often present with a running nose and cough, which are typical symptoms. You might also notice a sore throat, and in some cases, they have difficulty breathing, especially if the infection is more severe. Ear problems can also occur, such as pain or discomfort. Fever is quite common in these cases, indicating the body's response to infection. Patients often feel generally malaise, meaning they just don't feel well overall. Some might even experience an inability to drink, which can be a concern, especially in young children. These features help us identify and differentiate acute respiratory infections, guiding us toward appropriate management. Recognizing these symptoms early is crucial for effective treatment and preventing complications. Most children, as we know, often experience minor symptoms like a cold or a cough, which are quite common and usually not severe. However, it's important to understand that some children can develop more serious conditions, such as pneumonia. Pneumonia is particularly concerning because it remains a major cause of death among children worldwide. In addition to pneumonia, we shouldn't forget that sometimes diseases like measles and whooping cough can also lead to severe respiratory tract infections. These illnesses can cause significant health complications if not treated promptly. This highlights the importance of early detection and vaccination in protecting children from these serious infections. Overall, while minor illnesses are common, we must stay vigilant for these more severe conditions that can have life-threatening consequences. When taking a history and conducting a clinical assessment, it's crucial to gather key information that will guide our management. First, we want to know the age of the child, as this can influence the diagnosis and treatment approach. Next, the duration of the cough is important. How long has the child been coughing? This helps us understand whether it's a recent issue or something more persistent. For infants between 2 to 5 months, we need to check if they are able to drink properly. If the young infant is struggling to feed or has stopped feeding well, especially less than 2 months old, that can be a sign of a more serious problem that needs urgent attention. We should also ask about any recent illnesses, such as measles, which could have contributed to the current condition. Additionally, observe whether the child is excessively drowsy or difficult to wake. These are critical signs of possible deterioration that require immediate action. All these details, history and clinical signs, are essential in forming a complete picture of the child's health and determining the next steps in management. Let's consider some key questions when assessing the child's condition. First, did the child have convulsions? It's important to find out because convulsions can indicate serious neurological issues or infections. Next, is there any irregular breathing? Abnormal breathing patterns can be a sign of respiratory distress or other underlying problems. We should also ask about short periods of apnea, which are episodes where the child stops breathing for brief moments. These can be quite dangerous, especially if they happen frequently. Another crucial point is whether there's a history of the child turning blue. Cyanosis, or a bluish discoloration of the lips or face, often indicates lack of oxygen and needs urgent attention. We also need to know about any treatment the child received during the illness. Understanding what has already been done helps us plan the next steps effectively. Finally, check if the child has a fever, as this can point towards infections or other illnesses that might be contributing to their current condition. All these points help us build a complete picture of what's happening and ensure we don't miss any critical details in managing the child's health. Look and listen to the following. First, I want you to count the breaths in 1 minute. This is a simple but important step in physical examination. As children get older, their breathing rate naturally slows down. So the cutoff point we use to determine if a child has fast breathing will vary depending on their age. This means we need to consider the child's age carefully when assessing their breathing rate. Remember, monitoring breathing helps us identify potential respiratory issues early. It's a quick, non-invasive way to gather crucial information about their health. So, always keep in mind that age-specific guidelines are key to accurate assessment. When assessing a child's breathing, it's important to note these specific rates. For children under 2 months, a normal breathing rate can be 60 breaths per minute or more. For those between 2 months and 12 months, it's 50 breaths or more per minute. And for children aged 1 to 5 years, 40 breaths per minute or more can be considered normal. If you find a young infant, less than 2 months old, with a breathing rate of 60 breaths per minute or more, it's recommended to repeat the count. This is because the breathing pattern of young infants can be quite erratic. Sometimes, you might observe that young infants stop breathing for a few seconds and then breathe very rapidly afterward. This pattern can be normal for their age, but is important to recognize and monitor. Overall, understanding these different thresholds helps us better assess the child's respiratory status and determine if further evaluation or intervention is needed. When you're checking for chest indrawing, the key thing to look for is what happens when the child breathes in. If you notice that the lower part of the chest wall moves inward, that's a sign of indrawing. This means that the child is working harder to breathe than normal. Essentially, chest indrawing happens when the effort required to inhale is much greater than what we'd expect for their age and condition. Recognizing this sign is crucial because it indicates that the child may be struggling to get enough air, and it helps us decide on the urgency and type of care they need. So, Always pay close attention to the movement of the chest wall during inhalation. It's a simple but important part of assessing respiratory distress. When a child has stridor, you'll notice a harsh, noisy sound when they breathe in. This occurs because there's some narrowing in the airway, specifically in the larynx, trachea, or epiglottis. That makes it harder for air to get into the lungs. It's a sign that something is causing a blockage or swelling in these areas. Often, these conditions are referred to as croup, which is common in young children. Now, during an assessment, it's really important to look and listen carefully for stridor. Pay attention to how the child sounds and observe their breathing pattern. Recognizing this sound early helps us determine the severity and decide on the appropriate care. Remember, the key is to stay alert to these signs because they can indicate respiratory distress that needs prompt attention. When you see a child with a wheeze, listen carefully to the sounds they make. Often, you might notice a soft noise or signs that breathing out is particularly difficult. This wheezing occurs because the air passages in the lungs are narrowed. A key point to remember is that the breathing out phase, or expiration, takes longer than usual and requires extra effort from the child. This can be a sign that their airway is constricted and working harder to move air out. It's also important to ask the mother if her child has had previous episodes of wheezing within the past year. If she says yes, then we classify this as recurrent wheeze, which can influence how we manage and treat the child moving forward. Next, we need to check if the child is abnormally sleepy or difficult to wake. An abnormally sleepy child is one who seems drowsy most of the time when they should be awake and alert. This can be a sign of more serious illness or respiratory distress. Additionally, feel for signs of fever or low body temperature, as these can indicate infection or other underlying issues affecting the child's condition. And of course, always look carefully for wheezing. It's a vital sign that helps us understand the severity of the respiratory problem and guides our next steps. Malnutrition, when present, is a significant high-risk factor, and we see that the case fatality rates tend to be higher in these children. It's crucial to understand that in severely malnourished children who also have pneumonia, the typical signs like fast breathing and chest indrawing might not be as obvious as they are in well-nourished children. This can sometimes lead to underdiagnosis if we're not careful. Additionally, these children may have an impaired or even absent response to hypoxia, meaning they might not show the usual signs like rapid breathing or cyanosis, and their cough reflex can be weak or completely absent. This makes the clinical assessment more challenging, so these children require very careful evaluation for pneumonia and meticulous management. Now, moving on to cyanosis. Remember, that's a key sign of hypoxia. When checking for cyanosis, it's important to do so in good lighting conditions, because proper lighting helps us accurately detect the bluish discoloration of the lips, tongue, or palms. And finally, always look for signs of severe malnutrition. Recognizing severe malnutrition early is essential because it influences how we manage these children and helps us anticipate potential complications. So, in summary, when dealing with children who are severely malnourished, we need to be especially vigilant, thorough, and cautious in our assessment and management. Now, let's look at how we classify illnesses in children aged 2 months up to 5 years. This classification helps us understand the severity of their condition and guides treatment. First, we have very severe disease, which indicates the child is critically ill and needs urgent attention. Next, there's severe pneumonia, which is serious but not as critical as the very severe category. Then, we have pneumonia that is not severe. These cases still require medical care but are less urgent. Finally, if there's no pneumonia, but the child has a cough or cold, we classify that as no pneumonia. Recognizing these different categories is essential for providing the right care and ensuring that children get the appropriate treatment based on how severe their illness is. This classification ties into our overall goal of early detection and effective management of childhood pneumonia and respiratory illnesses. Let's go through the key points on this slide. First, we see the signs that indicate how we should classify and treat the child. If a child has chest indrawing or recurrent wheezing, this suggests a severe case of pneumonia. In such situations, it's important to go directly for treatment, meaning we should refer the child urgently to a hospital and give antibiotics right away. While waiting for referral, if it's not possible, we can treat with antibiotics at the community level. Next, note that if there's no chest indrawing but the child has fast breathing, this points to pneumonia as well. In that case, home care is appropriate, along with antibiotics. Again, we should ask the mother to come back after 2 days for reassessment, or sooner if the child's condition worsens. Now, if the child shows no chest indrawing and isn't breathing fast, then we're likely dealing with a common cold or cough, which doesn't require antibiotics. But if the cough lasts more than 30 days, it's important to refer the child for further assessment to rule out other causes. Finally, regardless of the specific classification, we should always assess and treat other possible issues like fever, ear problems, sore throat, or wheezing. These are common symptoms that need attention as part of the overall management. Remember, the key here is to recognize the signs early, classify the severity accurately, and take appropriate action, whether that's home care or urgent referral, to ensure the child gets the right treatment promptly. When it comes to young infants, especially those less than 2 months old, they can become seriously ill very quickly due to bacterial infections. It's important to remember that their symptoms can be quite subtle and nonspecific. For example, they might just show signs like poor feeding, or they might develop a fever or even have a low body temperature. These signs are not always obvious or specific to a particular illness, which can make it challenging to identify the severity early on. Because of this, any suspicion of illness in a young infant should be treated with immediate urgency. If there's any concern about pneumonia or other infections, these infants must be referred to the hospital without delay. Pneumonia in young infants is particularly severe and can deteriorate rapidly, so prompt referral and treatment are essential to improve their chances of recovery. This highlights the overall importance of vigilance and swift action in caring for the health of our youngest patients. Today, I want to highlight some warning signs to watch for in young infants, especially those under 2 months old. First, if an infant appears unusually sleepy or difficult to wake, that's a red flag. It could indicate serious infection or other issues needing urgent attention. Next, if you notice stridor when the baby is calm, that high-pitched breathing sound, that's a sign of airway obstruction or breathing difficulty. Also, poor feeding is another critical sign. If the infant isn't feeding well, it can quickly lead to dehydration or worsening illness. Wheezing is also concerning because it suggests airway narrowing or respiratory distress. Additionally, keep an eye out for fever or, conversely, a subnormal temperature. That imbalance can be a sign of infection or sepsis. Most importantly, these signs are considered danger signs of very serious disease in young infants, especially those under 2 months old. Recognizing these early can be life-saving, so always take these signs seriously and seek prompt medical care. This underscores the importance of vigilance and early intervention in managing young infants' health. Prevention of ARI is crucial, and there are several key measures we can take to reduce its incidence. Immunization, for example, is one of the most effective strategies. Ensuring children and vulnerable populations receive their vaccines can significantly lower the risk of respiratory infections. In addition, health promotional activities should be focused on vulnerable areas where the risk is higher. These activities help raise awareness and promote behaviors that protect health. Facilitating good living conditions is also essential. Things like proper ventilation and cleanliness can make a big difference. Advice on appropriate seasonal clothing is important too. Dressing children properly for the weather helps prevent respiratory issues. Providing better nutrition supports a strong immune system, making it easier for the body to fight off infections. Simple practices like avoiding long baths in open air can help prevent exposure to cold and drafts that might trigger ARI. We should also try to reduce indoor smoke pollution, which is a major risk factor. Using cleaner cooking fuels and ensuring proper ventilation can help here. Promoting and maintaining maternal and child care is fundamental. Healthy mothers are more likely to care for their children effectively and recognize early signs of illness. Finally, it's important to assess what mothers know, believe, and do regarding the causes, spread, prevention, and management of ARI. Educating them based on this understanding helps empower them to take appropriate actions to protect their children. All these measures combined form a comprehensive approach to preventing ARI and safeguarding community health. Vaccine hold promise of saving millions of children dying of pneumonia. 3 vaccines have the potential of reducing deaths from pneumonia significantly. Let's go through them. First is the measles vaccine, specifically the MMR vaccine, which is a trivalent vaccine. In India, this vaccine is given to infants after they complete 9 months of age. This timing is crucial because it ensures the child's immune system is ready to respond effectively. Next is the Hib vaccine, which targets Haemophilus influenza B. This bacteria is a major cause of pneumonia and meningitis among children. However, a big challenge with Hib vaccination has been its high cost, which has limited its widespread use in developing countries. This highlights the importance of making these vaccines more accessible and affordable. Overall, immunization with these vaccines can be a powerful tool in reducing childhood pneumonia and saving many lives. It's a critical part of our broader strategy to improve child health globally. Let's talk about the pneumococcal pneumonia vaccine, specifically PPV-23. This is a polysaccharide non-conjugate vaccine, which means it works by presenting capsular antigens from the bacteria to stimulate an immune response. It covers 23 different serotypes, giving broad protection against pneumococcal infections. A standard dose of PPV-23 is 0.5 milliliters, and within this dose, there are about 25 micrograms of purified capsular antigen. This concentration is designed to effectively provoke immunity without causing significant side effects. When administering the vaccine, it's recommended to give a single intramuscular injection, preferably in the deltoid muscle, which is the upper arm. This method ensures proper absorption and immune activation. Overall, PPV-23 is an important tool in preventing pneumococcal pneumonia, especially in vulnerable populations. Its broad coverage and straightforward administration make it a key part of our immunization strategies. This slide doesn't contain enough information. That's why we're moving to the next slide.